Right, so earlier today I put in a post about early extension. So obviously, if it's a technique issue, speak to your golf pro and work with him, work on it. But a lot of the golfers I work with, specifically golfers that come here to get treated, that the reason why they early extend, like moving towards the ball, is that they don't have the sufficient range of motion in this hip. So the lead hip, the one facing the target. Internal rotation is when you turn your foot in. Obviously, from a golf swing point of view, it's when you come down in your downswing. Now, not having this range of motion in the hip, what I'm going to show you today is if that is your issue, we're going to assess it, we're going to treat it, and then we're going to give you an exercise to help the treatment. Now, there's two types of exercises. There's ones that you do to try and lengthen the muscles, the fascia, the joint capsule, and then in those exercises, you're trying to just get that range of motion increased. But then there's a different type of exercise that you do after. So if you was to increase the range of motion in the joint, if I treat someone, I increase the range of motion in the joint, there's a serious set of exercises that you go through, and that is about making it stick. That is basically golfer specific, athlete specific, whichever way you look at it. So we're not going to cover those exercises. We're just seeing if you've got the issue and how we can fix the issue. So the first thing you can do, grab a 6-iron. Now, if you was to put the lie angle of 6-iron, this angle here, when you do that, is 60 degrees. So if you use this as your target line and you put that there, if you turn into this angle, you will see if you've got 60 degrees. Now, the best way to do it is if someone's looking at you, you want this to be what you're looking at. If you're filming it, set it up so that's the position. So you'll have your line set up there, so it's your start line. Like I say, we're testing the internal rotation of this hip. So we're going to come up on this leg, you're going to turn this way. I'll grab an alignment stick so you can see. But set up here, and in theory, you want to be either on that line, past that line, or short of that line. If you're short of that line, what I'd suggest you do is when you get to that position, mark that as a rough guide of where you are. So this test is testing the hip. There's a little bit of rotation in the ankle. Ankle restrictions can cause this, but most of the guys that I see and most of the golfers I work with, if they have this issue, it's in the hip. So first thing we're going to do is a treatment-based exercise. So let's say, for instance, that's my range of motion that I've laid there. We're going to find one of the main muscles that causes this is a muscle we call tensor fasciitis, TFL. And the way you find that, and what you're going to do is a self-treatment. So there's ways you can do it on the floor with balls and things like that, but this is an easy way that you can do. You can do it on the range if things feel tight. You can do it on a golf course. So you want to find that muscle, use your thumb, and basically if you lift your leg up, you will feel that muscle fire. It's roughly around here in your pocket. You'll just feel it fire. When you've found that muscle, and what you want to do is add a little bit of pressure, but you want to keep the tension there. And you're just going to add a little bit of pressure and tension towards the knee. So when you've got that position, you know where it is. What you're going to do, first of all, you're going to shorten this range of motion. So you're going to go into like a sway. Add the pressure and tension now, and then you're going to try and stay on the frontal plane. You're just going to slide. So because you're staying in the frontal plane, so you're not moving this way or that way, find the joint, find the muscle, sway, add pressure, tension, keep it there, and then slide. In doing that, you're loosening off that muscle. Then what you can do 2 or 3 passes up around that muscle. Obviously, it's attached to a band that goes all the way down. You've got fascial lines that go down towards your toe and up to your other shoulder and everything else there, but we're just working on that muscle and getting a release. And then retest yourself and see if it's increased. See if it was minimal, see how much you've increased it by. So that's the first thing to do, that's the treatment. Now, an exercise for it is what we want to do is you want to distract the hip, really. So you're going to take the hip and the femur, and what you're going to do is you're going to try and push that joint out as much as possible, and then you're going to add rotation. So if you was to sit down, whatever's comfortable with it, hands here, whatever you want to do. And then what you want to do is you're going to pull your toes back and you're going to push your heel away from you. And this will create distraction in the hip. And then you're going to rotate. But when you rotate, you continue to push that heel away. Because what you're doing, you're distracting the joint, and then what you're doing is then you're adding rotation. And it's similar to what you do in a treatment. Like obviously, someone would be face down. I've had some sort of compression and some distraction in there, but that's what you can do. Do it 30, 60 seconds. And again, test your internal rotation, see how you lie. Set up, obviously, left foot down, right foot up, turn, see how much rotation you got. When you do this test, if you increase your range of motion, remember there's one or two things now that's going to happen. You can hit some golf shots and obviously focus on trying to turn into that hip, but be aware that you've learned a movement pattern based around having that tight hip. So you're now doing a new movement. So I would suggest work with a golf pro, get in touch with your golf pro, work with them. If you want to do anything fitness-wise, you can obviously get in touch with me. But very, very simple. Assess, treat, exercise, practice golf, and see if it fits your early extension.